Hello, my name is Mayo, and I'm the founder of D Smiles Forever. D Smiles Forever is a mobile dental practice that provides in-home care services to underserved pregnant women of color who are on bed rest. And they also happen to be our target population. So some of the services that we provide at D Smiles include dental cleanings, oral health assessments and exams, fluoride treatments, as well as oral hygiene instructions that are specific to the patient's needs. Our mission here at D Smiles is to provide culturally competent and equitable dental services for underserved pregnant women of color for the benefit of both the mother and her child. Our vision is to integrate oral care into obstetric care for underserved pregnant women of color so that we can lower the rate of racial disparities. And the values that are sustaining our practice include equity, cultural competency, and cultural sensitivity. The reason why this business is so important is because it provides essential services to a frequently overlooked and vulnerable population. And also, since we're dealing with pregnant women that are on bed rest, it does cause limited mobility, which can inhibit them being able to transport themselves to a dental practice. So instead, we are bringing the dentist to them. And it also lowers the risk for developing poor oral health conditions. Now, according to research and scholarly endeavors, about 40% of pregnant women develop periodontal disease during gestation. And this can eventually lead to life-threatening complications with their pregnancy, such as miscarriages, sepsis, preeclampsia, and low birth weight for their babies. Unfortunately, there are some pregnant women who don't really prioritize oral care as part of their health regimen, so they just don't go. And it's usually because of a lack of education, or sometimes their dental provider may refuse service because there are some dentists that are apprehensive about treating pregnant women because they don't believe that it's safe to do so. But there are current dental guidelines that do say that it is safe for pregnant women to receive preventive oral care services. And oftentimes, lack of funding can prevent them from visiting their dentist or lack of insurance. And sometimes Medicaid doesn't typically offer dental coverage treatment for pregnant women. Now, my business changes the healthcare sector by engaging a very specific and frequently overlooked population, and it also integrates dental care into obstetric care services. And this can lead and promote change in the health sector by changing the methodology of how patient care is provided, by even potentially triggering expansion of the practice. Now, our biggest needs here at D Smiles Forever include funding assistance, preferably through grants, so that we can be able to purchase the mobile equipment to render our services to these patients. We also intend to collaborate with prenatal care providers like OBGYNs, if you want a holistic approach, midwives, and also dental researchers. And since we intend to store the electronic health records in our software, we also need technology support so we can store them safely without violating any HIPAA laws. And we also intend to use a mobile app so that patients can conveniently connect with their provider if they need to make an appointment or schedule any consultation visits. And the gap that this business fills is that it fills the lack of access to oral health care, and it offers mobile dental services through addressing the specific needs in the pregnant women that are on bed rest. Now, with our business, it responds to complex situations and ideas by using evidence that is fact-based. And we also intend to make sure we operate as ethically as possible. And we can start by allowing patients to keep their autonomy so that they can provide consent for any treatment we may recommend. And we will document that by having them fill out and sign forms to provide their consent. And if they see there is a provider that is of a similar cultural background, they will feel more inclined to develop that patient-provider trust because that is essential if we intend to reach underserved communities. And since we will be practicing in the state of California, our scope of practice will remain in alignment with the state of California's laws, as well as the infection control protocols, since we will be dealing with a high risk set of clientele. So, in conclusion, don't just think of this as a business. Think of this as a segue to bridge the gaps in our healthcare system to provide equitable opportunities for these vulnerable populations. Thank you.